I found out that I was pregnant at 5.5 weeks after I began to feel quite nauseated, and struggled from that point really onwards with quite severe nausea and actual vomiting. So I was coming to work and feeling that actually I was getting to a point where I really couldn't manage, because I was feeling so drowsy with the medication, but if I didn't take it I was feeling so sick. I have a hole in my heart which had previously caused a small TIA when I was 22 and 24. They were really reluctant with any of the other antiemetic medications, particularly because some of them can increase your heart rate, so they were quite cautious.
We first started using Acupins for post-operative nausea and vomiting, and we trialled them on the gynaecology ward, and we reduced nausea and vomiting in the hysterectomy ladies from 30% to 7%. And the gynaecology nurses were so impressed by this reduction that they asked if they could use it for their early pregnancy ladies.
And part of the advantage I felt was that it was something that I could do myself, that was really discreet, which wouldn't have the side effects, but helped me to stay at work, and hopefully help me to feel better.
It's a very simple procedure to do. To get the correct point, you have 3 of the patient's fingers from the crease here, and then you locate the 2 tendons. If you just bob that there. So the 2 tendons here, and it has to go in between at that point. So it is where a C-band should go, but it's a proper Acupin. So you clean the area. Just give it a minute to dry, and then this is an Acupin. So it just looks like a plaster, and that's the pin. So it's very, very small pin, and then it can stay there for 3 days. We started rolling it out, so the palliative care team are now using it. We've trained the rheumatology team to use them for people on methotrexate because they often feel sick, and we're also rolling it out on the chemotherapy suite.
I did actually take it out and experienced the same symptoms I'd had before. I felt very nauseated again, and had to put one straight back in, and felt really annoyed with myself that I'd then got to wait until it started to take effect again.
Having trained now all the midwives, the B11 nurses on gynaecology and the community midwives, we've seen a 36% reduction in people being presenting on gynaecology with nausea and vomiting in pregnancy. We've had a 20% reduction in admissions, and for those who are admitted, the length of stay is reduced by 36%. So it's had some amazing effects. One of the benefits as well has been to keep people at work. So when we've got staff struggling with nausea and vomiting in pregnancy, we can get them in early. And what I'd really like to do is train the GPs so that they can be put in as soon as the lady presents at the GP surgery with nausea and vomiting.